anesthesiologist. Let me take my mask off. Sorry, I just came from another patient's room. Yes, we're going to be doing a surgery on you today, so the doctor has just performed a cranial nerve on you, I believe. Is that correct? Great, that's excellent. Good. No, that's exactly what I wanted. What is that behind your head? Just 1 second here. Sorry, that was just your pillow. I saw a little bit of red. I wanted to make sure you're okay. How are you feeling? Are you okay? Good. So I'm your anesthesiologist today. The doctor that just performed the cranial nerve will be in afterwards to do the surgery. I'm going to go through a series of questions with you. I'm going to ask you some pretty personal questions, but I want to make sure that you're okay. Exactly, I want to make sure that you're okay when I put the gas on you. Exactly. Okay, so, like always, I need to make sure I have the right patient in front of me. I'm just looking to look at the doctor's previous notes here. Your name, please. Good. And, date of birth. Good. Your weight. Good. Do you know your blood type? Okay, you said something earlier to the doctor. Are you sure? I'll have to I'm going to get my nurse to double check with that, but I'll put down what you'd said. Plus AB. Okay. Alright, so I've got the right person. Thank you for confirming that information for me. So, like I said, I'm going to be the doctor putting you to sleep today. And what I'm going to need to do is I'm going to have to just clean your face off here. I'm going to use some medical tape, some nasal cannulas, put them up your nostrils. Slowly we'll go through the process of injecting the gas into you. First we're going to put the stuff that makes you feel good, sort of laughing gas. Yes, that's what we call it. Will make you feel a lot better. You'll sort of be a little high, as we call it, high on life, right? And then the next one will be the actual gas that puts you under, makes you fall asleep so that we can do the surgery and then you'll wake up and in recovery. Okay, how does that sound? Great. So I'm just going to clean off your face here. Now, with the nasal cannula, have you ever had one of those before? No? Okay, so what it is just they go up your nostrils, they loop around the backside of your ears, and then you'll just slowly feel like a of gas going into your nose. Continue to breathe normally when it goes into your nose, please. Don't try and take deep breaths or anything. It's just a flow of oxygen mixed with some gas that you'll feel going in. After about 30 seconds, you'll start to feel the effects going through your nose, and then you let me know if it's too much. But I've got my gauges here, and yes, I went to school for nearly 16 years. That's how long it is to be an anesthesiologist. So, first things first, I'm just going to grab some tape here. Good, I'm just going to get that ready. Okay, I've got the tape here. Now, like I said, I'm just going to be putting a nasal cannula down through your nose, your nostrils here. And if you've never had one, it's totally fine, don't worry. This is what they look like. Just your standard piece. This is where the two nostrils go in. Right there and there. This is where the air comes out. Oxygen and mixed gas goes in through these tubes here, down through the exit piece, all the way to this is where I plug it in to the machine. Exactly. Okay, let's get this started. Just be comfortable, please. Yeah, I'm just gonna put that right above your mouth there. Good. Now, is that comfortable for you? Good, it doesn't feel weird or anything. You got a little itch on your nose. Give me a second here. Did that get rid of the itch? Good. Great. So, I'm just gonna turn the gas on here. Just 1 second. Okay. Bear with me for a second. It's a big canister. Okay, got the gas on, so take some normal breaths for me. Just don't breathe. Don't over breathe by any means. Just inhale. nasal cannula just behind your ears here, so bear with me for a second. Good. Alright. I'm just going to tighten the back piece or as long as the back side of your head. Okay. Now, with the gas on and that on, how do you feel? Like I said, you would start to feel the effects pretty quickly there. That's okay though. That's part of it. If it's new to you, by all means, if it's new to you and it's starting to feel unsettling, let me know and we can sort of down it. We're going to be here for a couple more minutes before the surgeon, the doctor that did your previous cranial nerve exam, comes in. Yep, okay, good. So, while I've got this gas on you and you're feeling it, right? You feel a little loopy is the word. I just want to test your vision, make sure that you can still see me. Covering that eye, can you see me still? Great. Covering the other eye. Can you still see? Good. And if I cover both eyes, can you squint really hard for me just like that? I'm going to cover both eyes. Can you still see me just a bit? Good. Good. That's exactly what I need to hear and have you see. Great. And just testing the hearing. Both ears here. Can you hear that? Good. That's great. Stick your tongue out for me. Just want to make sure it's not swelling. The doctor warned you about those planes, right? He said that you had a good knack for hearing about which type of plane it was. Do you know which one that is? No? That's okay. Okay. Whew. This thing is pushing down on my head too much. You know, I wear this all day. It gets really uncomfortable. Now I'm just going to grab your tongue, just looking up here. Just making sure that there's no areas of swollenness, because while I can put you under so that you don't feel discomfort, you still have to continue to, subconsciously breathe. I don't have that machine. No, I just do. I numb the pain and make it so that your brain essentially just shuts off. But it doesn't shut off the circulatory system, being your heart or your lungs, to the pulmonary valves, bringing the oxygenating your blood. Good. I'm getting you a little session here. And again, these are all things that I'm going to do because when you wake up from your exam, I'm going to do the same tests again to see if anything changed. So smell this, please. What does that smell like? Good. And we'll just do it. Sorry. We'll just do it in the other one. Smell that for me, please. What does that smell like? Good. I know the doctor did a lot of these things, but I still need to do them just to double check. Just gonna listen to your heart. Breathe normally, remember. I know it's hard when you have the laughing gas. You can smile all you'd like, though. Okay, take a deep breath in. I'm just gonna come in behind you here. Just listening to your back. Okay, other side. Listening to your back. Good. I'm just gonna look over what the doctor had written here. Just compare my notes. I know those planes. Hopefully when you wake up, they're done taking off. Okay, I'm just gonna look at the doctor's previous notes here. I'm just gonna compare. Good. So, I like what I'm seeing here. You've got good taste, you've got good smell, your tongue is not swelling. How's the breathing? Can you take some good breaths still? Good. And the gas, that's not too much. You like it. I knew you would. Most people are afraid of it, but they start to feel it, sort of like. Anyways, I knew that you would end up liking it. Now, the last thing that I'm going to do here is I'm just going to get my mask back on. I just need to feel under your chin for quickly 1 second. Okay. Swallow for me, please. Just like this. I'm just feeling your Adam's apple. Good. And just the backside of your neck. to sleep. Exactly, but you'll wake up and the nurses will be there in the recovery room with you. This doctor, fantastic doctor to do any cranial surgeries. They're just going to remove, like I said, I don't know, have they gone over what the surgery is going to happen? So they're just going to take out a little section of your hair right there, and then they're just going to take off your skull, look inside, they're going to fix some of the nerves that are damaged from that accident, yeah. Do you remember the accident? Part of that is just due to memory loss from the accident. That's okay. You were in a motorbike accident. You were taking a turn, remember, and a car hit you. Yeah, this was actually years ago, but these are repercussions of things that have happened. I know. Anyways, I digress. The nurses will come in, take care of you. Surgeon, fantastic. So what I'm going to do is I'm going to now turn on the other gas, okay? This is the gas that's going to start to make you feel like you're falling asleep. I usually recommend counting back from 10. A lot of people try 99 and they get to like 95. So no point saying 95. Just start at 10. I'll count with you and then you'll slowly feel yourself drift off. And when you wake up, you'll be in recovery, okay? All right. The doctor's coming in a second, so I'm just going to get my mask on because I don't want to interfere with the gas. I don't want to breathe it in. So, okay. All right. So, deep breath in for me. I'm going to turn the gas on. Oh, these glasses, they just fog up on me. Okay. So the gas is on. I'm going to let it in 3. I'd like you to count back. Okay, I'm going to turn it on. Start counting with me, okay?